Hi, this is Jonathan Marks, and I'm here with Dr. Russ Barkley, PhD. Dr. Barkley is clinical professor of psychiatry at the Virginia Commonwealth University Medical Center in Richmond, Virginia, and he's also a widely published author on ADHD. He's going to be speaking at the upcoming annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders, this coming January 12th to 14th at the Washington, D.C. Marriott Hotel. His topic is Health Outcomes of ADHD by Adulthood, Implications for Life Expectancy. Dr. Barkley, can you give us an overview of what you'll be presenting?
I'd be glad to, John. Thanks so much for asking me. I'm going to be speaking, first of all, about the various life course health outcomes that have been associated with ADHD in a variety of longitudinal studies, including my own that took place in Milwaukee, Wisconsin with my colleague Mary Ellen Fisher and others. And there we followed ADHD children up for 20 years, reassessing them about every 5 years or so. And in the last two, particularly the last outcome at age 27 to 32, we evaluated their health status, just like an insurance company would do if they were going to consider issuing you a life insurance policy. And that's where I first began to see evidence that there was more to ADHD than just the educational difficulties and the relationship conflicts and the occupational difficulties that people with ADHD often struggle with. In addition to those things, we certainly documented those risks. We also began to see a rather troubling pattern in the area of health and health maintenance and risks that were beginning to occur that might have implications for the person's longevity. And although, given the young age of our group, we couldn't say anything definitive about that, it doesn't take an insurance actuary to begin to calculate how these things might play out. And of course, other follow-up studies published since ours have continued to document these risks, as have studies of clinic-referred adults for ADHD. Would you like me to go into some of these risks that I'm going to be speaking about?
Sure. I was just going to ask, can you give us an example of a few top-level risks that became obvious to you?
Yeah, I'd be glad to. I do want to say that the other risks that we already had identified, such as, the risk for limited education and so on, those do have implications for your life expectancy, believe it or not. People who don't complete high school find themselves often having a shorter life expectancy for a variety of reasons and others. But I'm not going to so much concentrate on that. I wanted instead to begin to look at things like, for instance, by adolescence, we have an increase in the use of nicotine as well as alcohol, and then eventually marijuana use throughout the adolescent years and into the young adult years. And these risks are specific to ADHD. I know everybody thinks that they're related to having conduct problems, which they are, but ADHD alone poses an increase in risk for using these substances. And we all know, of course, that if you smoke tobacco, if you use alcohol to excess, if you use marijuana to excess, but especially the first two, are likely to begin to pose health problems for you. And if those aren't treated, then those will go on, of course, and pose an increase in disease and health difficulties, and then eventually, as you know, shorten your life expectancy. We also saw that there was a growing risk for obesity, and this has now been documented in a meta-analysis by Sam Cortese and others, showing that over time, through adolescence and adulthood, people with ADHD have a propensity to become overweight. And eventually, by adulthood, they have double the rate of obesity of the general population.
Wow.
And as you know, obesity brings with it an increased risk for diabetes, for heart disease, coronary artery disease specifically, for stroke, and other things. And so we all recognize that those risks, our weight and the things that our excess weight poses for our health, also have implications for our life expectancy if they remain unaddressed. So I'll certainly be talking about those. And then, of course, there's the more obvious problems that we've known about with high risk for accidental injury, a growing risk for suicide in late adolescence and early adulthood. And of course, those immediately have a implication for life expectancy. For instance, a child with ADHD is 3 times more likely than a typical child to die by age 46. And while the risks are still low, 1% versus about 3% for ADHD, the fact is the risk is triple the general population, and that risk continues to grow as well, as do the risks from driving and so on. I'm going to be discussing all of that. And then, of course, we actually did blood cholesterol levels on our patients. I think we're the only study so far I know of that did that. And even by age 27 to 32, we documented a growing problem with an increased risk for coronary artery disease. And of course, that's related to your lifestyle and your obesity and your smoking and use of alcohol and other risk factors. The diet, of course, is very poor in many people with ADHD because of their impulse control problems. They drift toward more of a junk food, fast food, Western style diet. So I'll be going over all of these, and then what I'm going to do is show how, given recent information we have in medical research, you can take each of these and actually compute how much they are likely to reduce one's life expectancy. And there are actually little computer programs on the internet that you can go there and you can enter your own personal factors. It asks you a series of questions, and it tells you for each one how much it is shortening your life expectancy if it is a risk factor. And so I'll be using a lot of that very widely available information to just run some very quick calculations as to what might be the reduction in life expectancy given all these risks if you have untreated adult ADHD. So my intent is not to scare people or alarm them, but it is to activate an interest in this area, because what all of this says is that ADHD is a public health problem. It's not just a mental health problem, and that people who specialize in internal medicine, family medicine, public health need to be aware of the existence of ADHD as a risk factor for all of the other things they're trying to treat, such as risk for cancer and substance use and coronary heart disease and obesity and diabetes. All of these in various ways are related to ADHD, and yet people who work in those fields are completely oblivious to ADHD posing such risks. So it's really to educate our colleagues about these risks rather than to over-pathologize the disorder or scare people too much. But I do mean for people to take it as a serious condition.
Right. And Russ, I would think that these risks that you're talking about can also be stimuli for healthcare professionals to actually screen for ADHD.
Yes, and that is my hope, is that if you're seeing somebody who wants to quit smoking and they are struggling with that, or they have an alcohol use disorder and they can't seem to deal with that on their own, or they're engaging in risky sexual behavior, which is leading you to treat them for sexually transmitted disease more often than is typical, or if they are coming in and they're trying to lose weight. 40% of obese people have adult ADHD, and it's going to interfere with your ability to treat the medical problem that is before you, because you haven't screened for the underlying disorder of self-regulation, which is ADHD, which is going to prevent them from responding to your efforts at rehabilitation and risk reduction. So that's really it. If you don't look underneath the surface, under the hood here of these health problems for this self-regulation disorder, this executive function disorder, then you're not going to succeed at treating the health problems. So the ADHD needs to be identified and treated first if it happens to be linked to the health problem the patient is seeking assistance with.
Fascinating. This is an important message to get out, and Dr. Barkley will be doing that at the upcoming annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders. They're meeting this coming January 12th to 14th at the Washington, D.C. Marriott Hotel. Be there. You'll see Dr. Barkley and many other very informative speakers. Thank you, Dr. Barkley, for being with us.
My pleasure. Thank you.